So next up is Kristin Kirkpatrick, our favorite dietitian. You'll remember her from last year and the year prior. She's back with us today to discuss the relationship between food and our moods and how what we eat impacts our mental health every single day. Kristin is really busy. You've probably seen her on Dr. Oz recently or on the Today Show or at NBC Nightly News. And we're so fortunate that she made room in her schedule to be with us today. So Kristin, welcome.
Thank you all for being here again. I'm so happy to see these beautiful faces. Today is about love and compassion, so I want to start with recognizing my parents, who are celebrating 51 years of marriage today. Why don't you, what about a kiss? A kiss. Mom, Dad, a kiss. How about a kiss or a hug or something? People want to clap. That's a big accomplishment. So, today I'm going to talk about the amazing science that has come out in the past 10 years about the connection between what we eat and our depression, anxiety, our general mental health status. So raise your hand if you've ever had a night where you have like a huge bowl of steamed broccoli and afterwards you're like, I hate myself. Right? And now let's substitute that with a huge bowl of ice cream or a cheeseburger. I've said it. And then the other question is, how many people here are trying to manage their weight in some way? Right? A lot of times what we don't think about when we're thinking about, okay, the trendiest diets, and I'm going to do keto, or I'm going to do this, or I'm going to do that, is how those diets impact how we feel and how our mood is. Right? And there's a lot of science behind that. So I always start with nutrition in the news. I'm going to start with that today. This study just came out 2 weeks ago. No surprise. So when we are dining alone at night, we tend to eat about 28 to 48% less than we're dining out with friends. Is anyone surprised by that? So we looked at this study looked at hunter-gatherer and looked at our ancestors, and when they dined together, there was this protective mechanism of everyone sharing and everyone getting enough food. We don't need that anymore because 7-Eleven is like 500 feet away, right? So we don't have that capability to kind of regulate that. But when we do dine out with others, we eat a lot more, either because we're worried what it may look like if we don't eat enough. Vice versa, in this study, when they looked at obese women, they actually ate only 28% more. So again, kind of this norm of what are people going to think if I don't eat too much or if I eat too much, right? So I had a patient come to me once and say, well, I want to go vegan. What do you think are my chances of doing it? And this patient's wife had been my patient for years and was a huge meat eater. And I said, not good. Because your wife is a meat eater. Right? So there's a lot of social norms that we've seen in some of these studies that impact how much we eat and the success with this. This is another one, and there was actually a study that came out a few months ago just on this topic about mental health, food. I'm going to talk about some of the nutrients that are associated with this. But this was a big study that really looked at whether or not taking supplements made a difference, right? As a dietitian, we're kind of taught that food is always the ultimate source of nutrients. Supplements really shouldn't be it. There are exceptions to that rule. So vitamin D would be a great example, right? You would have to eat like salmon until your eyes pop out in order to get the vitamin D you need. But if you get D3, which is the D that comes from the sun, it's already converted in a way that our body understands it, then you have more of that capability to absorb it. So that's an example. And then later I'll talk briefly about a supplement called methylated folate that has to do with mental health as well. But for the most part, what we're finding is that if you're taking a bunch of vitamins and minerals, etc., as an insurance policy to a bad diet, don't expect that you're going to see the same benefits of what a good diet would give you. Right? Prevention of disease, longevity, things of that nature, okay? The only other place outside of that is if you're doing longer amounts of fasting, sometimes you need some supplemental. Okay, this was another one. So this looked at exercise, and just curious, how many people when they exercise in the morning have breakfast first? how many people don't have breakfast first? So about half and half. And that's been an age-old debate, whether or not we should eat before we work out in the morning. So we have some studies that show that if you don't eat, you have better fat utilization, you can burn more fat, you're not tapping into the body's preferred fuel because you didn't just have breakfast, which is glucose, right? So this was a big study, again, that came out a few weeks ago talking about that very concept. So looking about the fact that if you work out and you don't eat before that workout, you're more likely to help to decrease belly fat, more likely to tap into those fat stores versus those glucose stores. Another one, again, last year I talked about a lot of the different trends that we're seeing in diets. Mediterranean diet has always been a very strong diet, but not as sexy as keto or fasting. It's kind of got a boring factor, despite the fact that it has the most data in terms of longevity and disease prevention. So this was a study where they gave 2 groups of apes, either a Western diet, which you know I refer to as the SAD diet, the standard American diet, right? Or a Mediterranean diet. And so the Mediterranean diet is higher in carb, more whole grains, things of that nature. Very different from some of the trending diets that we're seeing today. And what they found was that the apes that ate the Mediterranean diets actually ate less. So they're able to regulate their food more versus the apes that ate the standard American diet, right? So Mediterranean diet's very high in fiber, more satiating, things of that nature. So one of the things I tell my patients all the time is something that can be very uncomfortable for people, and that is there really shouldn't be a time during the day where you feel full, right? And your goal should always be to eat until you're no longer hungry, not until you're full. It's really hard to do that because food tastes good, right? So if you're eating something and it tastes great, it's hard to say, oh, I'm not hungry anymore. I'm gonna stop eating that rigatoni. All right, we don't do that. It's really hard to do that. Babies do it and animals do it, but we come with a lot of baggage as we grow up and we want a little bit more food. So it's really difficult. So, the state of how we are today is no different than how we were last year when I presented here. So I saw this. I always have a cartoon somewhere in my speeches, and pepperoni's hard to resist. We still have a very obese nation. Even in Colorado, which is the state that I live in, we have the lowest amount of obesity. But if you look at our trends, we are still ticking up. We're not as high as the other places, but still ticking up. So despite the fact that we have had numerous public health campaigns, and people are so interested in nutrition, and there's a million blogs, right? Which is actually, that's a whole other presentation. That can be very confusing too. We're not getting better as a nation, right? What we're focusing on is not as good as what we need to focus on. And part of that is because it's not easy. Right? Food is something we have to look at every single solitary day. If you've heard me talk before, I always say that we can choose not to exercise, we can choose not to manage our stress, we can choose not to be mindful, but you can't choose not to eat, or eventually you die. So you have to eat, and food is everywhere. It's all around us. And in a lot of us, it defines who we are. Most of my patients that come to me now will come to me with, I'm on this diet, I'm on this diet, I'm not on this diet. They're not coming to me with, okay, what's your diet look like? Well, it's pretty good. I have a whole foods diet and it's like this. No, I'm on keto or I'm fasting, or there's something that's defining them. So when we look at the study of what's called and what was coined 10 years ago, nutritional psychiatry, we know that a lot of things that make us feel better about ourselves, less depression, less anxiety, better mood, etc., also happen to be better for disease management, for weight, etc. All right, so as I had mentioned earlier, this is a concept that came out in the past decade. So it is relatively new when we think about kind of this connection. I am the senior fellow for a behavioral health organization called the Meadows, which is in Wickenburg, Arizona. And so they do a lot of addiction. They're an amazing place. And so my whole goal with coming on with them was to change the food so that their food could now match their treatments, which is groundbreaking. I mean, they're actually treating the patients who have addiction and trauma and everything under the sun, but then when those patients go and have breakfast or lunch, the food complies with mental health standards. They're not having sugar and things like that. All right. And then diet and depression are linked. So this study, which was a randomized control study, was a meta-analysis, which means it's a very strong study. This looked at 45,000 participants, 16 trials were looked at, and what they found was that dietary interventions actually helped with depressive symptoms. So when we think of someone who is depressed, or we think of all the news right now about looking at our youth and depression and all the problems associated with that, diet is usually not an attention that we give to it. And I am not implying that diet should be the sole attention, not at all. Medications and behavioral management, that's the primary intervention, but you can't ignore the dietary perspective. You can't treat someone and then say, what are you having for dinner? McDonald's. Oh, sounds good, I love McDonald's. Right? You can't do that because we have too many studies saying that all of these things are connected. And if you think it's specific to just one age range or just a gender, that's incorrect as well. So what we have seen across the board, whether it's a young adult, an older adult, race, none of it matters. That we know that there are changes in the brain that occur, and I'll show you a trial that looks right before birth, that we know that what we eat has an impact on our depression, our anxiety, and our generalized mental health. So this is a big, big step in nutrition. We've talked for years about what vitamins and minerals to get and what's going to help you live long and what's going to help you lose weight. This is really needed now. This is really needed now, so we can't really ignore that. So mental health disorders and chronic disease go hand in hand with some of the same conditions that I see patients for all the time. So cardiovascular disease, diabetes, obesity, et cetera. And so we know that there are symptoms that come with that. And individuals that are diagnosed with depression, and there's levels of depression, of course, as well, they are much more at risk, much more prone for some of these conditions, okay? So they are really linked. When you look at something like young adults, for example, one of the studies that I looked at, which was really interesting, looked at what some of the motivating factors were for young adults in terms of diet. A lot of it was social interaction, if their friends were going to fast food places, things of that nature. But this one is an interesting one because it looks at just a brief diet intervention. So this one looked at two different groups. I think this was a college setting. And what they found is that even just having 3 weeks of healthy diet helped young adults with depression have less symptoms. Now, it's self-reported, but at the end of the study, they reported that they felt better, they felt more happy, and this was just 3 weeks of dietary intervention. So that's a pretty big deal. Like, this was a very short, brief period, and so that is really what was pinnacle to this one. This is, I had said that we have seen some studies looking at before you were even born. So there's plenty of studies looking at things like gut microbiota. The gut has a lot to do with mental health as well. And looking at how that impacts what happens to your overall health. This study looked at specifically maternal diet, so a high-fat diet, and they didn't distinguish between a healthy versus an unhealthy fat. So we're not just talking about saturated and poly and moly. I mean, we're talking about all high-fat foods. And what we found in this study, again in animals, was that it impacted serotonin and it impacted the long-term chances that the offspring of that monkey would actually have some sort of mental health disorder, right? Regardless of what that monkey did, once they were out in the world, it was the maternal diet that impacted that at the very beginning. It's a really interesting study. Yes, in animals, but still interesting. The other thing is we can also have a flip of things as well. So if we look at this, this is from the Journal of Circulation from 2018, so relatively new study. This looked at what happens when you have adverse childhood events and how that then can impact, obviously, depression, anxiety, things of that nature, but also looked at the factors of how you would choose your diet as well. So what happens with, are you going to eat fruits and vegetables? Probably not, things like that. So while we can look at diet and say that diet can help you with general mental health outcomes, we can also look at individuals in this study, for example, that may have trauma and then how that impacts their diet. So again, I'm saying that I talk to a lot of psychiatrists, psychologists, social workers. I'm showing you this because I know a lot of people that counsel people with depression and anxiety. And when I talk to them, I say, well, how much time are you allotting for diet? Or what are you giving them for diet? Or are you referring them to a dietitian? Do you have a dietitian on your team? Because it's such an important factor of what we look at in terms of overall treatment. All right, seeking happiness, fruit and veggies can help. So this looked at fruit and vegetable consumption. How many people think they're meeting their fruit and vegetable consumption requirements? That was pretty good, pretty good. And I often say that, like, when you think about like having 6 to 7 cups of fruits or vegetables a day, it's overwhelming. But when you put something like that in a salad, you can hit 3 really easily. 3 servings, very easily, right? This looked at having just 1 extra cup and what that did to reduction of depressive symptoms. Now, again, a lot of these studies are self-reported, so that doesn't minimize their impact, but people are reporting their depressive symptoms. Some of them you'll see in some of the omega-3 studies, actually, that did scores and things of that nature. Okay, so one of the greatest diets that has been proven to be beneficial for the brain, and that's where we know a lot of mental health is going to come from, is going to be the MIND diet. So the MIND diet is a combination between the DASH diet and the Mediterranean diet, okay? Has anyone ever heard of the MIND diet? Okay, so it does get like usually top 2 or 3 in the US News and World Report best diets, okay? And the results of the MIND diet are absolutely amazing, absolutely amazing. So rigorous adherence to the MIND diet, and I'll tell you what's in the diet. As you can see from this slide, reduction of Alzheimer's disease by 53% and moderate adherence by 35%. So this diet got a lot of press a few years ago when it came out, and it is an awesome diet. So there are good foods and bad foods in the MIND diet. Let's look at what the good ones are. Let's always start positive before we take away your ice cream. Green leafy vegetables, obviously, and then other vegetables would be things like beta carotene, like carrots, orange, anything that's orange, things of that nature. Nuts, so 1 serving daily. Berries, this is probably the 3rd or 4th study to look at Alzheimer's disease and dementia and how having just a serving of berries every single day can help to reduce that risk and help to improve symptoms of cognitive decline. Beans, okay, which is, again, not very popular right now because of keto, but beans are like the cheapest, probably most nutrient-dense food that we have on this earth, right? Whole grains, fish, poultry, olive oil, and then wine. I know we all like to see that. It's not on the other slide of bad. It's on the good one. But do you know what a serving is? It's nothing. It is nothing, okay? So go home tonight, take about a 5-ounce whatever, put it in your wine glass, and have your good cry. Because you're probably having more than 1 serving. And so for women, it's 1 serving a day of alcohol, liquor, beer. For men, it's 2. Men always get more because they have more muscle, so it's not fair, ladies. But that is kind of a joke, but not really. Measure your spot there. And then actually mark your wine glass, and over time, you'll kind of eyeball it, right? And you'll be shocked that you've been having 3 glasses of wine at night. Okay, the foods to avoid. Red meat. So there have been a few studies in the past 2 weeks that have come out saying that, like, hey, red meat's great. Don't worry about red meat. And I've done a lot of interviews on it because when people see that, they're like, okay, green light, red meat's wonderful. But we know that there are plenty of studies that would tell you that that's not the case. Not to say that you should never have red meat, but if you eat it rarely, you're more in line with the MIND diet, which is good. Butter, right? You can kind of see a pattern here. No more than a tablespoon a day. And never eat margarine because, as you know, most margarines are like not real food. And for the past 3 years that I presented here, I always started with Michael Pollan's slide on what food is, something that comes from nature, was fed from nature, and will eventually rot. That's the definition of food, and that should be 90% of what you're eating, okay? All right. Cheese, unfortunately, that goes along with the wine. So good, but let's have less of it. obviously pastries and sweet, and then fried foods. So I did talk about observational studies. This study was not observational. This actually did brain scans, did MRIs, and looked at levels of concentrations of certain vitamins and nutrients and how they would increase and impact mental health in study participants. So this was a much stronger study that actually looked at these scans and the circulation of some of these nutrients associated, in this one B and D, alpha and beta carotenoids. So this actually helped to see if circulating levels of these vitamins and minerals helped with mental health, and it did. Eat less junk food. This is another one. So my second cartoon, right, the Happy Meal. But it is true. So we've seen about 3 to 4 studies come out in the past 6 to 7 months linking fast food consumption with unhappiness. So I did start with that joke at the beginning that we don't have a bowl of steamed broccoli and then sit there and say, I hate myself, but you might have a Big Mac, a shake, and fries and make that statement. And it's funny, but if we look at the studies, it does show that there are changes in our brain chemistry and our gut microbiota that actually do impact whether or not we feel good or bad after that. And if fast food is a norm in your life, and you have depression or you have anxiety, it is linked to worsening symptoms of that. We also know that fast food alters the immune system. This has nothing to do with mental health, but we are in cold and flu season. So if I'm going to motivate you, here's another reason to try and avoid it as much as possible. The other thing is that when we look at certain foods that are not good for us in terms of mental health outcomes, they tend to be the same foods that we become addicted to, right? So there is definite evidence, most of it in animals, but some in humans, that food is addictive. And sugar, in particular, can be incredibly addictive, right? It's why, if I go back to broccoli again, you can stop eating broccoli at some point and feel really good about yourself. But a bag of Twizzlers, it's hard to stop, right? For a lot of reasons, but we do know that some of those same foods are hijacking the same system. So just a few slides on sugar. So I've shown this slide every single year. This is from Walter Willett out of Harvard, looking at an easy to digest carbohydrate versus a hard to digest carbohydrate. So easy to digest is going to be sugar, refined grains, anything that makes insulin and blood sugar go up rapidly and then go down rapidly. So that process is inflammatory. There are inflammatory things that are associated with mental health outcomes. So all of those things are associated, again, with the inflammation that comes from the up and down and the up and down and the up and down of blood sugar. If we're doing everything right, which is really hard to do, our blood sugar should be pretty even keel throughout the day. Eating till no longer hungry, not feeling fullness. I tell my patients to go to bed hungry. It's not a comfortable thing to think about, right? But you won't wake up hungry. So I always say, like, what are you fueling overnight? Your body's going to keep you alive, right? So we have to think about our food as fuel, and we don't need to fuel to prepare for sleep. We don't need to do that, right? So that's like one of the things that I've been giving my patients right now. We're going to change the clocks. I think Tammy told me we're going to change the clocks like next week, right? Something like that. We're going to get less daylight. So if you want a tip today, don't eat once we change the clocks when there is any dark out. Don't eat when there's dark out, right? So you will be doing a time-restricted feeding approach or time-restricted eating. And time-restricted eating is eating no more than 8 hours a day. And that's a fasting mechanism. So if you're not eating anything outside of daylight hours, you'll be fasting. And the lack of sun and the presence of the moon should be a nice reminder for that. Okay, so little things like that that you can do, especially now. And then obviously hard to digest carbohydrates, you're still gonna have an insulin boost because it's a carbohydrate. You need insulin to take sugar to your cells. But with the hard to digest carbohydrate, you don't have the peaks and valleys, you just have more kind of lumps, all right? I always show, again, the importance of nutrient density. So while we know calorie counting doesn't work, we also know that if you look at calories and you think they're equal in any way, you only need to look at a slide like this to know that they're not. How much you would be filled, how much more you would be satisfied if you had the strawberries versus the Skittles, but also what I'm trying to show is the mental health aspect to that as well. If you think it's just the United States, wrong again. This was a very big study in the journal Depression and Anxiety. They looked at Canada, France, Germany, Korea, New Zealand. Higher rates of depression related to specifically to diet. So again, not a new concept, but not something that's necessarily trending in what we're talking about in this day and age. Okay, we already talked about addiction for that one. So the sugar addiction, the perpetual cycle, you don't have to raise your hand, but if you've ever felt that you were in this cycle, you can. My hand will be up there with you, okay? Safety in numbers. You eat sugar, you love it, your blood sugar spikes, okay? And when your blood sugar spikes, you get that dopamine increase that's being like, hey, this feels good, let's have more. And then you do, you have more, you get the rapid decrease of blood sugar, or like what I had shown with Walter Willett's slides. So the rapid decrease of blood sugar, that can then lead to fat storage and the loss of that sugar high. So that's when you feel like I need more, or I'm tired, or whatever the case may be, and then it starts again. Okay, that cycle starts again. I'm gonna skip these because I got 5 minutes left. All right. Food and mental health. So these are the big nutrients that are associated, that we have plenty of studies on, looking at the connection between certain nutrients and mental health. Obviously, sugar and junk food we just covered. Omega-3s and the omega-3s, most of the studies we're looking at could be supplemental. I know it's confusing because I just told you that supplements don't always work, but in a lot of these studies, they use supplements. In some of the other studies, they look at actual fish consumption. So 2 major trials have come out looking at individuals that were put into one of 2 groups, either a group that had increased omega-3 consumption or a group that just had social intervention to be like in a group setting to talk about depression, to deal with depression, anxiety, etc. In both studies, the Mediterranean diet group with the supplement of omega-3 fatty acids fared better in terms of overall depressive symptoms. These were huge studies comparing social interaction and a behavioral health group with diet, specifically Mediterranean diet, but also the inclusion of looking at that omega-3. So that's a big one as well. So in the SMILE study, again, whole grains, olive oil was another big one. A lot of interesting thing, and the Mediterranean's a big one too. Optimizing vitamin D. So again, I see a lot of patients, and when I see patients, they'll say, well, I'm not really on vitamin D. Should I be? Probably, right? What I tell my patients is go find out what your vitamin D status is. If it's too low, take a D3. And then track that with your physician so that you know whether or not you gotta make your dose higher or lower, et cetera, okay? So vitamin D is a big one as well. Here's a bottle of D3. So with a lot of foods, we eat a lot of different foods, and our body has to work to convert those foods into a form that our body understands. Vitamin D is one of them. So when you have fish and you get vitamin D, your body's like, I don't know what you just gave me, but I'm gonna use genetics, which you're gonna hear about later today, to convert this vitamin D into a form that I do understand, and I'm gonna absorb that. Right, so there's different genotypes and things like that that impact that conversion rate and how efficient that conversion rate is. So supplement's gonna be the way to go on the vitamin D. Okay, another study here, women with moderate to severe depression, substantial improvements with vitamin D. Folate's another one. I mentioned something called MTHFR. Has anyone ever heard of MTHFR? Okay, so I was expecting that, probably about 25% of the room. So MTHFR is essentially necessary to take folate past the blood-brain barrier, it's like a chaperone, into the brain. And that is important because if you have an MTHFR deficiency and you eat tons and tons and tons of folate, because you want to have better mental health, it's not going to do much. The chaperone's not there. So in these cases, and again, talk to your physician about this, at the Cleveland Clinic, we have tested many people for MTHFR deficiencies. About 40% of people have it. And once we supplement them with a methylated folate, sometimes our patients will mention it as brain fog. They will say that their brain fog has lifted. You need folate in the brain. There are plenty of studies showing if you don't have folate in the brain, you're more likely to have depressive symptoms, anxiety, brain fog, etc. Okay, so it's just something to think about from that other supplemental form. And here are some supplements where you can already get it. I love Smarty Pants. You're going to start seeing this in more vitamins because there is sugar, but all of their B vitamins are methylated, right? So if it's the only sugar you're having throughout the day, it's okay if you don't want to go for the other route, okay? So again, talk to your physician about that. And then the last one would be getting a good gut. So many studies looking at overall gut health and our general mental health. We also know that there are medications that are given for depression and anxiety that actually impact serotonin levels negatively in the gut. So it's kind of like this bad joke where we're taking a med not to be depressed, and yet those are the same meds that are inhibiting serotonin in the gut and then inhibiting our ability to actually get better naturally. Okay, so another thing to think about and talk about with your physician if that's something that you're looking at. Anxiety is the other one. And then just kind of, I showed this last year as well, just looking at the gut-brain axis. We could talk for hours about the gut, but there's such a huge connection between our gut health and how our gut and our brain are communicating and what that means for overall health. These are the modes that determine gut health. Again, we could go into a lot more detail about it. And then if you're not exposed to enough germs, right? When I lived in Ohio, I had goats and a pig. And people would come over and see my kids and be like, oh my God, like where's the hand sanitizer? I guarantee you my kids are getting less sick today because of that. So exposure to some of those germs and things like that. Okay, so, whew, I made it on time. I showed this one last year, so this is from, I'll end with this, the Institute for Functional Medicine has this fabulous sheet for kids. It also works for adults, showing what are the highest phytonutrients, what are the different colors. Color always helps with overall diet and overall improvements of diet as well. So if you're struggling with yourself or struggling with your kids, I would take this with you to the grocery store. You have your kids or whatever, yourself, check off something in every box. And it's not going to be Fruit Loops, right? Or anything like that. Because color is going to determine nutrient density. Color, the more deep the hue of something is, the better it is for your health. It has been an honor and a privilege to talk with you today. Thank you so much for your time.